In today's age, we live in a youth-oriented society, and slowly our world population is not only growing but aging. Virtually every country in the world is experiencing growth in the number and proportions of older persons in their population. One of the 21st century's accomplishments is the transformation of better health care. The infant mortality rate has gone way down, and there is a growing number of adults living longer. However, these accomplishments can have downsides. For example, people are living longer, meaning there is an increase in demand for high dependency related services. This could cause societal budgets to possibly spiral out of control with the increased need for services for the older adults. Research says there is a need for a shift in the healthcare model. But what could be done about this? Could intergenerational living be the solution? But what is intergenerational living? Intergenerational living is where different generations live in the same living environment, meaning grandparents, parents, and their grandkids could be living under the same roof. This has been a common practice in many cultures for centuries, but in today's North American society, independence is celebrated, and living miles away from family is often the norm, and the traditions and the many benefits have gone by the wayside, and we send our elders to retirement communities and assisted living in nursing homes. In countries in Eastern Europe and Asia, multi-generational housing within families has been a standard for years. Although intergenerational living isn't super common practice here in North America, there is enough research to suggest that perhaps there is a benefit to different generations living together, as well it may be a way to cut costs and save money. There are many benefits for seniors to be living in a multi-generational environment. For starters, it can reduce a sense of isolation for older adults and potentially relieve or lessen depression. By living at home, the seniors can receive help with activities of daily living, such as grooming, daily tasks, and grocery shopping, which can prevent injuries that would lead to hospitalizations. By being surrounded by youth, it welcomes intellectual challenges for the older adult by having to stay involved and active at home. Overall, just staying involved gives them a sense of relevance and genuine purpose in life. Often when younger people interact with older generations, it's seen as a younger person helping the older person. But it's more of a give and take relationship where both parties learn from each other. Living under the same roof helps people of all ages break down the stereotypes they have for one another, normalizing interactions between generations. There is sometimes a difficulty in defining a clear dividing line between normal aging and pathological aging, which have led to stigmatization of older adults as a social and economic burden. But all generations can learn new skills from each other. Older adults can stay current from the younger generation, and the youth can benefit from the mature mentoring they receive from their wise elders. Living together can also help younger generations understand aging and face their own more positively. The earlier that we can normalize the experience of aging as a part of life, I think that people will not only have a different perspective about their own aging, but respect the elders around them. There can be many perks to living in an intergenerational living setup. So why doesn't everyone just do that? I've gone right to the source, and I've asked the public about their experiences with living in an intergenerational living setup.
So that's a loaded question. I think it's quite a moral dilemma, actually. Here it is, your parents have raised you and have done so much for you in most cases throughout your life, and now they're wanting to move in with you. And usually when they want to move in with you, it's for reasons such as financial issues. The mental health is deteriorating, their physical health is deteriorating. So it just adds to the stress of a family that maybe parents are both working, you have kids, you're trying to bring them up, you're trying to pay your own bills, and now you have this new person living with you, and not just a person, it's your parents or a parent. And you feel guilty if you put them in a home, but then there can be resentment when they're actually living with you. And it can just add to the stress of the household and maybe even affect your relationship with that parent, the grandkids and the parent and the grandparents and the kids and the parents. Yeah, it's not all negative though. We did have an experience last summer where my mother-in-law lived with us, and So all the negative things I mentioned we did experience, but the positive was she actually still helped out around the house. She would clean things. She would take her turn cooking dinner at night, which was great. Um, she got to spend time with the kids and vice versa, and you could see the joy that it brought her. And that's nice to see that what we're doing actually makes her happier. I'm even thinking in some cases where there's maybe single moms and the parents move in with them to actually be a help. And I can see how that would be very beneficial in that situation. The kids grow up close to be with their grandparents and vice versa, and I can see how that would be very helpful in both cases. I'm sure that wouldn't be without its challenges as well.
My experience living with my grandma was very interesting. It was COVID, and my grandma moved in, and she unfortunately took my room, so I didn't really have a space to myself. And with it being COVID, everyone was kind of locked in a house and couldn't really move, so everyone that was here during the day kind of, got to see each other's flaws that you wouldn't normally see if you didn't grow up with someone. Also, I was, doing school online at the time and didn't have my own space, so I kind of felt the need to entertain my grandma while also trying to, maintain my school and work on my homework and stuff like that. So it definitely had its challenges, but she helped me with some things. So yeah, there's that.
What things did she help you with?
She taught me some new skills. She helped me learn how to cut hair. So yeah, there's that too.
The last interview we had set up was supposed to be with my grandma, who had been living with us on and off for the past month or so, as well as with another family in Edmonton, on and off for a little bit, just to discuss her experience living with family. Last minute, she decided to cancel the interview because she did not feel that she could express her experience in a positive way because she didn't have a positive experience with that family in Edmonton. She said that she had a positive experience with us, but not with the other family. By this time in life, everyone has kind of established their values and their likes and their dislikes, and when you add another person to the family, that can oftentimes throw off the family dynamic, no matter how close you were, and that can sometimes be too hard for some families to deal with and cope with, and even for the seniors. It's just sometimes it doesn't work and sometimes it does. As we can see, there are many pros and cons of intergenerational living, and sometimes it isn't right for everyone. Despite the fact that families can get along relatively well, having someone live with you can cause many stressors on a family. For some people, it maybe isn't an option to have a parent living in the household because of financial reasons. In this case, young people living in a shared household with their parents might still expect greater help from the state through regulatory measures and fair distribution of social assistance between the young and the old generations to create a social and housing policies that are fairer and friendlier to younger families. Colleges across the country have started to take this shift towards intergenerational living, with programs with students living in senior care facilities. Many of the students get free or discounted rent through the program and are required to contribute to the senior care facilities by volunteering, organizing programs and events, and eating meals with other residents. Society seems to be finding new ways to improve quality of life for those around them. Although intergenerational living isn't for everyone, it is something to think about moving forward in the future planning of senior care. Finding ways to integrate all demographics and ages is never a bad thing and can have a positive effect on the way we view and treat people. Our world is changing and our healthcare system needs to continue to grow and develop with it.